All right. Well, good morning, everyone. It is 9:02 a.m. on June 26th, 2023. Thank you all for being here live in person on HPM's channel. So very much appreciate your time and attention this morning. We've got some interesting, fun, exciting, and urgent news. So I'm glad that you are all here to hear it first. As we normally start, other than a nice paycheck at the end of the month or week or whenever we get compensated by the carriers, we are also here to improve the lives of our community with affordable healthcare. That's first and foremost. Thank you for having a passion for that. It's definitely been a passion of mine. And we are always looking to help others, even though we don't get compensated all the time, right? We're going to talk a little bit about what I'm talking about there is doing some goodwill for the community because it always comes back. That's the way that I see it. So with that, though, we also need to remember to keep one foot in the classroom and the other one in the field at all times. So with that, let's go over some training for the week. It is training season. As a reminder, AHIP 2024 is now out. So you can go ahead and start your training. Some of the carrier trainings are beginning to roll out as well. I'm actually very surprised that some of the carriers already have their certifications ready and are launching those this week and beyond. So you should already start to begin getting some emails from the carriers. If you've already certified for 2023, you should get a recertification instructions. We are also going to build a page where all the certification instructions and recertification instructions are going to be housed. So we are building that right now for 2024, and then we'll share that link with you via email and text message, so you have the opportunity just to review and ensure that you've got all your certifications under control. Since AHIP is out, you can go over to AHIP and take it. It's $175 as normal. However, most of the carriers now have a certification link that saves you $50. So if you can't find that, just shoot us an email, support@askhpm.com. We're happy to send you over an AHIP link there, but the carriers usually have that automatically sent out to you. So if you need it, just let a team member know, and we're glad to track one down and get it done for you. Also, on a side note there for certifications, recertifications, please remember, when you are done with your certification, send it over to contracting@askhpm.com. or support, doesn't matter. Just send it to a team member because we need to ensure that you are ready to sell and the carrier is saying that you're ready to sell. Believe it or not, not all carriers tell us that you're ready to sell. So I know that's an assumption in our industry, like how come HPM doesn't know that I'm RTS? Sometimes the carriers don't tell us. I know it sounds counterintuitive. We're working on that with them, but at the same time, we've been very proactive. But the best practice is when you finish certification, please send us the certification award or whatever it is that says, yes, you are now ready to sell. That might be an email. That might be a certificate itself. But please make sure you're sending us over a screenshot, an email, a copy of that. You can send it to contracting@askhpm.com. We want to ensure that you have your RTS ready to go and we don't have anything slip through the cracks. We are requesting RTS counts from each of the carriers. Some are faster than others. Some of them don't send it at all. So it is what it is. So I apologize for any of that. Just keep in mind that that's just the name of the game. All right, so let's go through some training here for the week. Later today at 2 o'clock, Humana is doing a certification webinar. So this is a kind of like a preemptive, hey, this is what you need to expect out of Humana this year. Humana is our #1 selling product at HPM for 2023. Recertification is very important for us and for you because all that hard work that you did in 23, you got to recertify for 24 to keep those renewals, keep that commission, keep coming in month in and month out, okay? You worked hard to track it down, make sure that you get the big ones out of the way. So Humana is doing a training class on how to get through that certification. If it's anything like last year, it should be a breeze. Also, Humana is doing a member care assessment. Remember, you get up to $60 for those HRAs is what we call them. internally. They're doing a quick training on that at 3 o'clock today. United Healthcare has open virtual office hours at 4 o'clock. So if you have any questions, concerns, anything you might need from United Healthcare, they will be available at 4 o'clock today. Moving over to tomorrow, the 27th, we've got Humana doing their new agent Vantage portal. Again, this is their home base, their portal system for agents to come in, and they're doing a quick training on that. I think it's smart. There's a lot going on in that portal, and it's got some cool features in there. So if you've never been there, if you've never been in a training on how to use that portal, it's probably a good idea that you jump into that. That's tomorrow at 10. Also tomorrow, WellMed and Optum is doing kind of like a road show here where they're going out and doing summer conferences. They want to meet you. They need agents to work with. They need agents to send their leads to. Let me repeat that. They need agents to send their leads to. If they don't know who you are, if they've never met you, if you don't go to their events, if you don't say hi, they're not going to send leads to you. It's just very simple. So this is a great time of year to go out, schmooze with these guys, shake hands, talk to them, and see what opportunities that you might that might be open to you in your specific area. But at any rate, you should be meeting the people that could influence your business. And so I'd say make it a point to go out to these physician meetings. The first one for WellMed Optum is tomorrow at 4 o'clock. You can jump in there, and they're doing things like headshots, speaker, and networking opportunities. You've got doctors, you've got support staff coming from the clinics. They've got food and drinks. I mean, it's probably a good idea that you guys go there. So there's information here in the training calendar, but also they sent you emails as well. If you need help with any of that, please let us know. We're happy to help. Okay. All right. Let's go over to Wednesday. Wednesday, we've got our very own Al Clancy. He's doing our virtual coffee and chat session, and he is here to help us out with anything that you might need. That's at 9:30 on Wednesday. Just jump in, join the Google Meet there, and you can ask away any questions that you have. This is a really great opportunity for you to kind of get a coach. Every great player on every great team had a coach. Michael Jordan, Mike Tyson, all of these guys, Tom Brady, they all had coaches. Some of them still have coaches. They just believe in that, and you have to have somebody there to help you along the way. Al is a great coach. He's seen a lot of great agents succeed, and he saw a lot of great people not make it. So, this is a good time for you to cross-check, work with Al, and see if there's anything we can do to up your game here. Okay. So that's on Wednesday at 9:30. Also on Wednesday at noon, Care Plus is talking about benefits, but they're going beyond the copays. So these are things that are kind of hidden between the lines there. Care Plus will be doing that training at noon on Wednesday. Also on Wednesday, 12:30, Cigna's doing their virtual office session as well. So wherever you are in the world, Cigna will be available to you. Wednesday at 2 o'clock, Humana is going to deep dive into their dental and vision. Now, these are standalone plans that you can use to offer to your members. And you can also use it as a lead gen opportunity. And we're going to talk about lead gen here a little bit today. But dental and vision is these are really great products. Also, these products are available on Shop. So you'll have ancillary products that you can offer your members. Just remember that sticky rate with your members, your clients, almost doubles when you have 2 or more products. Okay. You have 2, 3 products with that member, they're not going anywhere. Retention rate becomes stronger, and so they think twice before shopping around for another health plan or another dental plan or another vision plan or whatever it is that you've got them on. Okay, so there it is. Thursday, Health First is doing an integrated care program. If you're in any of the Central Florida area where Health First of Florida is doing integrated care programs, Remember, they have a hospital system, they have provider groups, but they also have a health plan. This is a really great program to learn about integrated care. I think this is the way that the world's going to go at some point. So, if you're interested in learning more about the care model, this could give you a leg up over your competing agents. Okay, that's at noon on Thursday. Check that out. We've got a live session with Al Clancy. So if you'd rather meet with Al live in person, he's going to be available at 2 o'clock on Thursday at the Panera Bread in Winter Garden. So check that out. Again, same thing applies. If it's just better face to face, go ahead and talk to Al, and he'll be there at 2 o'clock on Thursday. And then the last thing on the week is United Healthcare virtual office sessions that are available again at from 3 to 5 on Friday. Because nothing rounds out your weekend like a nice office hour at United Healthcare. We are going to be talking about United Healthcare this morning in just a moment. But I also want to remind you that we do have a pre-recorded Medicare shop training. This is going to be coming down soon because we are going to be hosting a Medicare shop 2024. That shop training is coming out soon, and then we'll have those rolling in the same type of fashion so you guys can get your questions answered and make sure that you're ready for Medicare enrollment season coming up quick. 90 days, guys. 90 days. Can you believe it? It's already here. All right. Let me go over here. Moving on over to. All right. I want to remind you guys very quickly that we are still running our Google review contest. And as a reminder, if you haven't already left us a Google review, we just ask that you go out to our page here on Health Plan Markets. I will, again, send out the link in the chat so you guys can have that. But please go ahead and leave a review for us. We want an honest review, so obviously we can improve upon things that need to be improved on. Thank you guys very much. Several of you have left us 5-star reviews. We can't thank you enough for that. But that doesn't mean we're going to stop. We're always looking for ways to improve. So if you have any suggestions, post them there. But for every person that enters a review on Google, you get a $100 restaurant voucher. And that is good for a coupon book that you can take around to restaurants to get things like 50% off, buy one, get one, really great things. I've already started sending them out. Again, $100 worth of restaurant vouchers in that just for leaving the review. And then in 3 days, I will be randomly selecting. We're doing our spin the wheel contest here. So everyone that left a review gets the chance to go on vacation. Yes, we are giving away a free vacation on our Google review here. So if you haven't entered the contest, if you haven't left us a review, you still have time. We're going to do the drawing we're going to close the contest on the 29th. So you have today, tomorrow, and Wednesday to get your review in. Plenty of time there. And then those of you that did leave a review, if you want to have a second entry to double your chances of winning, you can send over a video testimonial to us, and we will enter that in as 2 entries into the contest. So if you haven't done a video entry, send that in. You have 3 days to do so, and we will double your chances of winning. We'll put you in twice to win that vacation. Okay. We sent out a video, a text message, an email about it. If you haven't got it, let a team member know, and we'll be glad to send that back out to you. But we still have a few days left. I want to make sure that you guys have the opportunity to win a free vacation. And if not, at least you get $100 worth of restaurant vouchers. So I don't know, take you 2 minutes, 3 minutes. We'd appreciate it. Thank you, guys. Okay, on to pressing urgent news here. I am here to tell you that United Healthcare has sent out letters to their members, and this includes all line of business. And before everybody panics here, this is for Central Florida. United Healthcare has terminated their relationship with Orlando Health. Orlando Health is a major hospital system here in the Orlando market. Orlando Health has hospitals, doctors, urgent cares, surgery centers. So this is across all lines of business for United Healthcare, Medicare, individual, group, the whole 9 yards. And it includes all facilities of Orlando Health. So it's a 100%, we are done and over with Orlando Health, effective August 1st. So this is about 30 days out, and they're saying that they're going to terminate Orlando Health. Now, with that said, I just want to tell folks here that are listening on the call, we've seen this happen before. We've seen these types of situations happen. If you have members on United Healthcare that are accessing Orlando Health and they're calling you, please don't panic. Let them know what they have options. Their options are obviously to find new providers and remain on United Healthcare, right? And if not, let's search for an SEP to keep them with their doctors so you can help them find a new health plan. There's an opportunity there, guys, right? We'll talk more about that in a minute. So those are the opportunities there. Or they can wait until October, which is right around the corner, and we can go shopping for a new health plan to see what we can do to help them get back into Orlando Health if that's their decision. Some people are going to say, hey, I don't really care much for Orlando Health. I'm a fan of United and I just want to keep it. Help me find a new doctor. And then you're going to have people that are like, oh man, I really got to keep my doctor. I got to let United go. What do we do? There's going to be, both sides of the fence there. Okay. In these situations, I will caution you first and foremost, please do what's right for your members. Please absolutely do what's right for your members first and foremost. Unfortunately, these types of business decisions do fragment people's care, and it's unfortunate. But this is also a business. So unfortunately, lives are going to be impacted from the loss of physicians. This happened, obviously a little bit earlier this month, but I have seen that members are receiving letters as early as Thursday of last week, from what I've seen. So letters are going to continue to be sent out. Again, this impacts all United Healthcare members, and especially those members that are using Orlando Health right now. So if you're getting those phone calls, please know that these things, this is official as of August 1st. However, as I said before, sometimes these scenarios play out where they come together and at the 11th hour they say, no, never mind, we're good, we figured it out, and we're gonna play nice again. So be prepared for both. It could actually go all the way through, or they come back sometime in July and say, we fixed the problem, and you don't have to worry about it. So these are situations where the carrier and the organization are flexing on each other, and they're trying to figure out obviously this has to do with money, that there's no way around that, but they do have to figure that out. So if you need help reaching your members, if you need a mailer, a text message, a email, a voice drop, if you want us to do phone calls for your members, whatever it is that you need help with United Healthcare in these situations, we're happy to help. Just let us know. Again, shoot us an email, support@askhpm.com, or give us a call. You guys should have our number here. I'll pop it in the chat as well, 844-696-3975. Call us, and we're happy to help you and assist you in any way that you see fit, okay? There it is. All right, so just keep that in mind as we're moving forward. There is a little bit of disruption here in Orlando. Okay, let's talk about, switching gears a little bit, let's talk about ACA. Because there has been some new changes in ACA. So this month, actually, on Father's Day, they announced this, but CMS has now created a regulation for collecting consent for ACA members as well. And so I'm going to read you this article. This is from Health Sherpa. This is effective on June 18th. So that was last week they rolled this out. So I'm going to go ahead and read this article so you're familiar with what's happening with ACA and why it should matter for you, okay? So this is a summary of CMS guidance on new consent rules effective 6/18. This is for individual and family plans, not Medicare, individual and family plans, ACA, Obamacare, however you want to call it. This is what that's for, okay? New CMS requirements make agents, brokers, and web brokers responsible for documenting consumer consent and reviewing application accuracy. CMS covered their new rules around consent and review for all marketplace enrollments at their CMS Summit for Agents and Brokers on 5/24/23. These rules build upon the existing rules that were outlined in the 2022 Understanding Marketplace Compliance Rules and Regulations slides found here. So they have slides here in case you need them, as well as various frequently asked questions that address consent and PII rules and regulations. When comparing the 23 Understanding Key CMS Rules and Regulations to Maintain Marketplace Compliance slides to the rules and regulations from the previous plan years, the following are some of the key additional requirements that will need to be met in addition to past guidance. This is not an exhaustive list, so be sure to review the 23 rules and regulations yourself when developing your consent document systems for plan year 2024. Now, we're going to be part of the document consent and all that. We're going to keep you posted, but we have a very good feeling that Health Sherpa will have this baked into your process at some point. They're pretty good with that kind of thing. So first thing is consent documentation requirements. The consumer or their authorized rep must take an action to produce the documentation. Provide consumers a process with which they can rescind consent. A brief description of the scope, purpose, and duration of the consent provided by the consumer or their authorized representative, in addition to the previously required fields. So basically what this is saying is you have to provide these members with some way saying that I give Justin permission to talk to me about health insurance. So however you're doing that in a text message, an email, if it's an inbound phone call, that should do it because they're calling you. But I would have some type of form. Now, I have sent out these forms previously, but remember, Health Sherpa is coming up with a system, so I would keep that posted as well. Review documentation requirements. Maintain documentation stating a consumer or their authorized rep has reviewed and confirmed their application information is accurate. So you have to send them back their app to make sure it's good. The consumer or the authorized rep takes an action to produce the documentation. The documentation must include, at the minimum, the following information: the date the information was received, the name of the consumer or their authorized rep, an explanation of the attestation at the end of the eligibility application, the name of the assisting agent, broker, or web broker. The agent, broker, or web broker must maintain the documentation for a minimum of 10 years. So guys, this is very much becoming like a scope of appointment for Medicare. Remember, you need to indicate what products you talked about. In this case, it's individual and family plans. That you talked about health insurance, and you've got a date and your name on it. Exactly, and their name, of course. So protecting consumer PII. You must provide consumers the opportunity to opt in and allow you and your agency, if applicable, to use their PII through the record of consent. You should also provide a mechanism through which the consumer or their authorized rep can limit the use of PII. PII may only be used for the authorized functions discussed earlier in the context of completing an application for QHP, APTC, or CSR eligibilities, if applicable, or enrolling in a QHP or qualified health plan, or any data transmitted from or through the marketplace, if applicable. PII may not be used for any other purpose not outlined in these agreements without the explicit consent of the consumer or their authorized rep. So it's saying that we need to let them know that we could use their information as an agent and as an agency along with their health plan. Third-party relationships. Agents and brokers with any third party with which they have entered into a business relationship must adhere to requirements for the use and disclosure of all consumer PII and protected PHI, including PII, PHI collected by the third party. Agents and brokers are required to obtain consent from the consumer or their authorized rep. Third-party means such as lead generators do not constitute consent in a manner that complies with the finding there, okay? For example, consumers merely checking a box to indicate that they attest to being enrolled in a marketplace coverage does not constitute consumer consent for purposes of complying with the CMS marketplace requirements. So they have to have consent saying that, yes, I am interested in talking to an agent. So lead gen companies are already working on this consent to contact, I can tell you that much. System usage. CMS systems that agents and brokers access when assisting consumers include, but are not limited to, the CMS Enterprise Portal, healthcare.gov, and Health Sherpa EDE and DE pathways. Only maintain one CMS Enterprise Portal account accessible by the registered agent or broker. Only conduct one login session at a time. No scripting or automation without written CMS permission. The documentation requirements go into effect beginning June 18th, 2023. They are not retroactive. Agents do not have to go back and gather documentation for applications completed before this date, but should implement these practices moving forward. We do expect further guidance in the form of clarifying frequently asked questions to come from CMS by or shortly after this date. Remember, all the rules and regulations around consent and client review are to help you protect your clients in your relationship with your client. All right. So there it is. If you have any questions surrounding IFP or ACA about collecting consent, please let us know. They do have a form that we sent out and we'll have on the Gold Key that you can use, which is created by CMS, and you can send it to your members for signature. So we can do that as well. We're happy to help, set you up and get you that stuff. So ACA consent to contact is now a thing. We have to go out and collect it, okay? All right, so with that, I'm going to switch gears into one of our brand new services here at Health Plan Markets, and it correlates in between ACA and Medicare, and that is Medicaid verification. Many of you may still be calling some of the carriers and trying to verify Medicaid. Well, we now can do that for you. So it's very simple. We set up a secured form, and this form I'm going to drop in the chat for you here. But this form specifically is for Medicaid verification and, if necessary, the application. So we have somebody internally that's going to lead this project, Miss Angie Caros, who is going to be there to help us, help you verify Medicaid, and, if necessary, help you apply for Medicaid for your member. Okay, this is a free service at Health Plan Markets. Angie's going to be tracking it using the form internally here, but I want to go through it very quickly with you. So you have eyes on this, and you now have it in your inbox here or on your chat session there, okay? So you put your name. Obviously, we want to know who you are, what state you're verifying Medicaid for. So if you're in Georgia, you click Georgia. You're going to put your client's first name, last name, their gender, and date of birth, okay? So those things are required. We do have to have those things. Now, moving down the list, please enter prospective member Social Security number or Medicaid ID or Medicaid member ID or both below in order to submit this request. So we need one or two of these things, either the social or the Medicaid ID number, in order to verify Medicaid. Okay, so we do need their name, gender, and date of birth, and then either the social or the Medicaid ID number. We're going to need one of those in order to make that happen. Now, we can also verify by Medicare. So if you know they already have Medicare, you can put their Medicare ID number. We can verify that way as well. Now, this is the same form here. If you know your member doesn't have Medicaid, but you want to help them apply, Angie will help them apply on your behalf, okay? So on the bottom section, we still need the top section. We still need their first name, last name, gender, and date of birth. But at the bottom here, if you would like HPM to help you apply your client for Medicaid, please enter their contact information. Our team will reach out to the member and help them apply. So we just need a phone number, their email, if they've got one, and then anything else we need to know. Okay, so maybe they're applying for, son, daughter, husband, wife, whatever it might be. Maybe they're the authorized rep, whatever we need to know, it'd be good to put it there, okay? And then Angie's gonna go ahead and take this information, give you a call. She has your information on file, and she'll help apply those folks for Medicaid, okay? So there it is. If you have any questions on this or you need some help, please let us know, and we are happy to help you with that. All right. we're at the top of the call here. One last thing I want to share with you guys is on your Spark platform, your Medicare CRM here. It's been redesigned. On the left-hand side, you can see they've added a new section called marketing. So basically what they did is they took a lot of the marketing stuff out of the My Account, which was listed under here, and they now put it under marketing. So I want to go through this with you really, really quick because it's important that you have this stuff set up, because we're going to start setting up your AEP campaigns to send out to your book of business automatically from Spark if you've signed up for it. But you need to have your bio set up. You need to have your picture loaded, your phone number right. If you need the Health Plan Markets logo, reach out to us. We can send it over to you to help you upload it. If you want to add or change your brand colors, you can do that. But this is basically why we're doing it here. Everything is tied into your very own website. Yes, all of you that have Spark have a website here. And so it'll have the same information here that you just loaded on the other side, okay? So in order to prepare for AEP, it's a really good idea just to review this information, make sure that you've got everything set up. One thing I want to point out too is if you go under My Account, you'll notice on the right-hand side that you have your address, your website if you've got one. Again, you can use ours if you want, askhpm.com if that makes more sense for you. But they now added a scheduling URL and a LinkedIn profile. So if you have a scheduling platform like Calendly or Motion or something like that, you can put in the scheduling URL so people can actually schedule a call with you, okay? So that kind of goes back here. When you click schedule, they fill out a consent to contact form. Okay, so it's very seamless on that side of it. But just go ahead and spend a few minutes to review your marketing, because I don't want, postcards and things going out and you didn't really want it to look like that or feel like that or whatever the case might be. Okay, so again, under marketing, just go through your information and make sure that everything's there. And we're happy to help you with that. All right. A couple questions on the chat here I want to answer. Tom is asking how long to get a reply. Right now, it's going to be very slow, so we should get a pretty quick reply back from Angie, but it really all depends on A, did we reach your member? B, what state are we doing the Medicaid application for? And how fast does the state reply to? We don't have any control over governments. However, right now, I'm pretty sure Angie's doing applications same day. So as long as we get a hold of your member on the same day, we can go ahead and take care of it. She's saying that the state replies back in about 5 days. So thank you, Angie, for that. Appreciate that. But Angie replies back immediately in case you're missing any information or anything like that. On our side of it, we're going to start working those Medicaid applications. All right, and Tina's asking, can we track to know that they have successfully gotten Medicaid, or will Angie let us know, the agent know? Absolutely. So as soon as we get word back from Medicaid, hey, this person's approved, Angie's going to reach back out to you and say, hey, your member's been approved. So that's all going to be tracked on a sheet. Angie's already set up with it. She's been trained. She's got it all situated there. And she will reach back to the agent as soon as we have an update. Okay. She'll also inform you the submission and the status. So sometimes they're missing information or they need more information in order to apply for Medicaid. So that's something Angie's going to take over for you. So this is a really great service that you can offer your members. And right now, I know we had an agent ask us, can you call my book of business and offer this service? And we said, absolutely, we can do that. So we're working with an agent to help him call his book of business and offer this, not just for his members, but anybody that might need help, anybody that they might know that needs help, which is going to generate referrals for him, right? So there may be people in your book of business that qualify for Medicaid, don't have it, you guys never talked about it, and this service, we can help them apply and get some extra information there. Angie's saying, please try to get the username and password, since it will be better to renew the benefits that make a new application, or rather than making a new application. Thank you for that, Angie. Let's fix that form. We can put that on there. I'll see if I can work on that. But yeah, if you do have the username and password, that is helpful. because she can log in and do the application that way if they've already done an application in the past. But if they don't have a Medicaid application username and password, don't worry, we can still figure that out. Okay. Tina is asking, what if they need to reapply? Will she help them with that? Yes, absolutely. We'll help with reapplications. Right now, we've got Medicaid redetermination. We see that happening everywhere. Again, this is a service that we're trying to do to help you guys alleviate a lot of that, Medicaid work. And then Angie's saying, if somebody is denied Medicaid, please let me know. We can fight those benefits back. So we've had several instances where Medicaid was denied and she was able to go in there, work her magic, and get them approved. So just another service, if you tried on your own and you couldn't get it, or the member tried on their own and she couldn't get it, then Angie can step in and try to help out. So this is a new service for HPM. It's a beta test. Thank you, Angie, for leading this effort. We appreciate it, but it's going to be a little bumpy in the beginning. We appreciate your patience as we work it out, but I feel like we've got a good system so far, and I'll be sending out an email with more information about Medicaid later this week on how we can help you in that regard. So. Yeah, I think so. All right. Elisa says, thanks. I think this will be helpful. Absolutely. Absolutely. Our goal is to alleviate as much as we can off your plate so you can go out and prospect and find new members to help. Okay. So with that, we're at time. Thank you guys very much for being on the call this morning. I can't thank you enough for being here live. Just remember that we do have the YouTube channel on there. So if you miss a session, you can go on our YouTube. Make sure you subscribe. Make sure you turn on notifications. So when we post another video, you have the most recent information very quickly. Like we discussed today, we had urgent information. If you're not subscribed, if you miss a session, it could be weeks before you find out, and we don't want that to happen to you. All right. With that, guys, I hope you have a fantastic, strong closing last week of June. It's the last week of Q2. We're getting ready for AEP, lots to do. So keep your head down and good luck out there. Please let us know how we can help. Thank you very much.